And the World Health Organization says the New York case suggests that the swine flu outbreak in Mexico has now passed among people who never left the U.S. The WHO flu chief Dr. Keiji Fukuda said the virus could be strong enough to produce larger outbreaks outside Mexico, possibly causing a flu pandemic. But he added it is still too early to say if a pandemic that threatens the whole world is inevitable. Fukuda said it is entirely possible that the world might see a very mild pandemic, but he urged caution, saying that the flu pandemic of 1918 started out as a mild spread of disease, but later became severe and killed over 40 million people eventually. The WHO has advised countries to make sure national plans are in place to ease the impact of a larger outbreak. We begin our program in Mexico, where a number of deaths believed caused by swine flu has climbed to 152. The country's capital has closed public places, including gyms and swimming pools, to prevent the spread of this disease. Meanwhile, the outbreak has already spread to at least 6 other countries. The U.S. says the number of confirmed cases on its soil has risen to 64. Li Xiang has more details.
Supermarkets in Mexico City are full of shoppers stocking up on supplies, prompted by the swine flu epidemic.
It looks like some people are storing food as if there were a war coming.
But public places, including schools, cinemas and restaurants, are empty after the government ordered them to shut in a bid to prevent the spread of the disease. That strategy has inevitably affected business.
The sales drop is around 90%. Only one person has come so far, and tomorrow is going to be worse.
Officials in the Mexican capital said over 6,600 people went to city hospitals with flu symptoms Monday, but only 29 remained hospitalized. Over in the United States, there has also been a surge in the number of confirmed cases. New York has the largest number of swine flu cases in the country. A heavy concentration is at this school in Queens. Some of the school students who recently returned from a trip to Mexico are suspected of having contracted the swine flu virus.
You have to go on to, doing your work also, so you can't let it consume you. But everybody is, of course concerned.
As the number of confirmed cases in New York City climbed, the mayor tried to reassure residents. Michael Bloomberg said that people with confirmed swine flu cases in the city are so far showing only mild symptoms.
This has been following the pattern of normal seasonal influenza. Nothing worse so far.
Meanwhile, health officials across the U.S. have stepped up efforts to look for cases, especially among people with flu-like illness who had traveled to Mexico. Li Xiang, CCTV.
And U.S. scientists hope to have a key ingredient for a swine flu vaccine ready in early May, but they say that the new virus grows slowly in eggs, which is a key step in flu vaccine production. Even if all goes well, it will still take months before any shots are available for the necessary safety testing in volunteers. And the researchers must engineer a strain that could trigger the immune system without causing illness. The U.S. Food and Drug Administration swine flu chief Dr. Jesse Goodman says scientists are working at 100 miles an hour to create good raw material to deliver to vaccine manufacturers. And the Center for Disease Control and Prevention says work is about a third completed.
The Ministry of Health has tightened nationwide measures to test people who may be infected with swine flu and set up a timely reporting system to control the disease. And preventative methods at all levels of government are gearing up. Yuan Xiaoyuan reports.
Within days, the new strain of swine flu has spread across borders and killed more than 100 people. Although no cases had been reported in China as of Tuesday, the world's most populous country is well aware of the threat and is taking action to keep the disease away from its doors. Checkpoints across the country have been tightened up. Airports in Guangzhou and Changsha have set up equipment to check all passengers' temperatures. Those with a temperature higher than 37.5 degrees Celsius must go through further checks. Travelers who have recently visited North and South American countries or are unwell will be given particular attention at Shenzhen's border checks. Learning lessons from the SARS outbreak in 2003, medical institutions across the country are ordered to be fully prepared for the swine flu. The Ministry of Health has urged medical institutions to step up monitoring of suspected swine flu cases and report confirmed cases immediately. All medical institutions are required to set up special clinics for patients showing swine flu symptoms, and experts have been sent to provide consultations and treatment across the country. Beijing has designated 3 hospitals with experience treating SARS patients to receive swine flu patients. The Ministry of Health is in contact with the World Health Organization and the US and Mexican government for the latest information on the epidemic. And the ministry is willing to provide medical support for countries hit by the swine flu. China has banned the import of pork and pork products from Mexico and several US states to minimize the risk of a swine flu outbreak. Food Safety and Agriculture watchdogs have set up working teams with the Ministry of Health to monitor the situation and deal with any emergency.
Hong Kong has launched the same plan to prevent an outbreak of swine flu that it used to combat SARS in 2003. Hong Kong health authorities and virus experts say that they will take all necessary measures to avoid swine flu entering the special administered region. Surveillance measures have been stepped up at border control points.
Hong Kong has escalated its alert level to serious in response to the swine flu virus. The Food and Health Bureau has held an urgent meeting with related departments to implement the preventive plan.
If this virus is going to be a very effective human-to-human transmission, we should prepare for the worst.
Chow is also urging residents to avoid traveling to affected countries. Air passengers with respiratory symptoms are urged to report to port health officers for examination. The government will work closely with the University of Hong Kong to develop faster testing methods for the virus and step up public education about the disease. Pharmacies and drugstores are seeing a surge in sales of masks and disinfectants. Hong Kong's subway company has also launched preventive plans.
Now we clean the carriages every day. We also sterilize the turnstiles, ticketing machines and elevators with disinfectant every 4 hours.
Preventive measures have also been strengthened at other public places. Disinfect hand cleanser dispensers have been installed at shopping centers. The local government is urging the public not to panic.
The virus is not affecting pigs directly and will not be transmitted through pork. So I must reassure the public that consuming pork will not lead to infection.
Many people are still buying pork at Hong Kong markets, but the pork vendors are worried that the price may fall. Wang Guan, CCTV.
After an emergency meeting, Taiwan's Disease Administration Department has declared swine flu as a level 1 infectious disease. It also vowed to keep the public updated on the latest news. Threat of the epidemic triggered a surge in sales of disease prevention supplies.
Taiwan authorities have launched an epidemic fighting mechanism in response to swine flu. So far, no cases have been reported in the region, but the public has begun to take preventative measures. In pharmacies and drugstores, surgical masks are flying off the shelves. Stores are increasing their stock to avoid a repeat of the acute shortage of masks that was experienced during the SARS epidemic.
We receive email orders from the customers even during the weekends. There are also lots of phone calls for additional orders.
Mask manufacturers say sales have doubled, and sales of clinical thermometers and hand cleansers are increasing by 10% a day. Stock prices of medical equipment makers have risen, along with increasing sales, despite an overall downward market trend. Stocks of some food companies have also risen as people turn to chicken over pork. The local government is urging people not to panic. It fears that the sudden spike in demand for some medical supplies may lead to a shortage in hospitals. Emma Moore, CCTV.